The fight against HIV has come a long way. Decades ago, an HIV diagnosis was considered a death sentence. Today, antiretroviral therapy, ART, allows people living with HIV to lead long, healthy lives. But ART is not a cure. It only suppresses the virus. The ultimate goal remains a permanent cure. While major progress has been made, especially through groundbreaking stem cell transplants, the road ahead is a complex, expensive, and it calls for a strong national investment in research. Stem cell transplants, a glimpse of hope. One of the biggest breakthroughs in HIV research came from a surprising place: cancer treatment. So far, only a handful of people worldwide, approximately 7, have been functionally cured of HIV, and they all share one thing in common. They received stem cell transplants to treat blood cancers like leukemia. These transplants came from rare donors who carry a genetic mutation known as the CCR5 delta 32. This mutation prevents the HIV virus from entering the immune cells. These patients received bone marrow or stem cell transplants from donors with the CCR5 delta 32 mutation, and after years without HIV treatment, their cases are considered cures. These success stories are inspiring but not practical for most people living with HIV. And here's why: the high risk and cost. Stem cell transplants are dangerous and expensive. They are usually only done for patients who also have life-threatening cancers. Rare donors. The CCR5 delta 32 mutation is very rare, mainly found in about 1% of people of Northern European descent. That makes it extremely hard to find matching donors, especially for people in Africa, Asia, or Latin America. Rejection and side effects. Even if a match is found, there is a high risk of the body rejecting the transplant or suffering from complications like graft versus host disease. In short, these cures are real, but not a realistic option for millions of people living with HIV. HIV remains a massive public health issue in many parts of the world, particularly in sub-Saharan Africa. ART has saved millions of lives, but it depends heavily on continued access to drugs, monitoring, and support, often funded by external donors like PEPFAR, the United States President's Emergency Plan for AIDS Relief. When the Trump-era funding for PEPFAR was threatened, it sent shockwaves through health systems that rely on this support. Though funding was eventually renewed, the incident exposed a dangerous vulnerability: too much reliance on foreign aid. To ensure long-term resilience, countries must build their own research capacity, and this includes investing in local research labs to study HIV, develop new drugs, and test potential cures, train local scientists in virology, immunology, and pharmaceutical development, establishing vaccine research centers to participate in global efforts for HIV prevention, supporting clinical trials that reflect the unique genetic and environmental conditions of the local population. The future beyond ART and towards a cure. There are several promising paths scientists are pursuing. Gene editing, like the CRISPR, to alter immune cells so they resist HIV infection. Broadly neutralizing antibodies that can target many strains of HIV. And therapeutic vaccines that aim to train the immune system to control or eliminate HIV. Latency reversing agents that flush out hidden reservoirs of the virus in the body. But all of this require deep, consistent investment and not just from wealthy nations. The dream of curing HIV is no longer science fiction. It's possible, but not yet scalable. While isolated cures through stem cell transplants prove that a cure can work, they are not the answer for everyone. To make real progress, we need to invest in our scientific future. That means building research infrastructure, funding local innovation, and preparing for a world where we are not waiting for external donors to save us. Self-reliance in health innovation isn't just a goal, it's a necessity. I go by the name of Latest. Thanks a lot for watching. Take care and God bless.